How can families discuss bioethics with teens meaningfully? Imagine sitting down with your teenager and having a conversation that helps them understand some of the most important questions about genetics and morality. It might seem tricky at first, but it's all about creating a space where everyone feels comfortable sharing ideas. When talking about bioethics with teens, start by explaining what genetic testing is. Tell them it's a way to look at their DNA to find out about inherited health risks or traits. Make sure they understand that this information can affect not just them but their family too. Next, introduce keywords like heredity and bioethics. Bioethics is about the moral questions that come up with advances in biology and medicine. For example, should we test children for adult-onset conditions? Or who gets to decide if genetic information is shared? Explain that genetic data can influence family relationships, privacy, and health choices. It's important they see these topics are about real-life decisions, not just science. Create a respectful environment where teens can ask questions freely. Let them know their opinions matter and that their moral reasoning is developing. Be honest about the benefits and possible risks of genetic testing. For instance, testing might reveal unexpected results that could cause worry or family tension. Talk about how to handle such surprises with care and honesty. Discuss ethical principles like respecting their growing independence. Explain that they have a right to make informed choices about their health information. Also, talk about beneficence, which means doing good, and non-maleficence, which is avoiding harm. These principles help guide decisions about testing and sharing results. Justice is about fairness. Who should have access to testing and how to share information fairly within the family. Encourage them to think about privacy. Who should know their genetic information? How can they keep their data safe? Talk about the importance of confidentiality and respecting their wishes. Practical steps include providing age-appropriate education about genetics. Use simple language and real-life examples. Consider involving a genetic counselor who can explain complex topics clearly and support your family's decisions. Before testing, discuss scenarios together. For example, what if the results show a health risk? Should they tell other family members? How might that affect relationships? Planning ahead helps everyone feel more prepared. Make sure to keep the conversation ongoing. As teens grow, their feelings and opinions might change. Check in regularly and be open to revisiting these discussions. Most importantly, respect their choices. If they decide to proceed with testing, involve them in the decision. If they're not ready, honor that too. This way, they learn to trust their judgment and understand the importance of making informed health decisions. By approaching bioethics as a shared family dialogue rooted in honesty, respect, and education, you help your teen develop a thoughtful perspective. This prepares them to handle complex genetic information confidently and make choices that align with their values.